Well, welcome back. This could certainly bring back some triggering emotions. Hospital waiting rooms at capacity, mask-wearing patients desperate for treatment of a debilitating respiratory illness. It may sound and look like the early days of the COVID outbreak, but it's happening right now as we speak in China. There is a surge in respiratory infections, and it is overwhelming hospitals there. So China is responding, and it insists that this is not a new virus plaguing its citizens, but a natural surge of existing, very common viruses all hitting at once without any lockdown restrictions. But this really, well, seems to be especially hard for some of the youngest in the country. NewsNation's Brian Entin is following the story, and he joins us now. I mean, Brian, you know, when I start to read more about this story, I sort of get a little bit of chills. I mean, we can all remember what it was like back in 2019. We thought it really was just a cold, right?
Yeah, absolutely. And the video that is coming out from over the weekend in China, it will sort of give you chills. It's like a flashback. And we're talking about China here. You can't necessarily believe the explanations that they are giving. But according to the experts we spoke to today, they said all of this may actually be a symptom of 3 years of lockdowns in China. The images coming out of China are like a frightening flashback. Hospitals and clinics full of sick patients in the northern part of the country, including Beijing. The respiratory illness seems to be impacting mostly children, despite causing the World Health Organization to take the rare step of publicly asking China for more information after a report of undiagnosed pneumonia in children. The WHO says data they've received shows the outbreak is caused by the flu and other known diseases, not something unknown like what we saw with COVID.
There's limited detailed information available to fully characterize the overall risk of these reported cases. However, due to the arrival of the winter season, the increasing trend in respiratory illness is expected.
China has not always been forthcoming with the world when it comes to outbreaks. With SARS in 2003 and again with COVID in 2019, they were not initially open and transparent. But infectious disease expert Dr. Monica Gandhi says what's happening in China now is less about a secret virus and more about what she calls immunity dead.
This is something we would expect after 3 years of lockdown, that children had not been exposed to respiratory syncytial virus, mycoplasma, common colds, RSV, influenza, any of a number of viruses. And it's actually very expected that we would see a lot all at once, a lot of respiratory illnesses all at once.
And the immunity debt explanation really is interesting when you think about it, Elizabeth, because I sort of forgot that they were on lockdown so much longer than us. They were on lockdown for a full 3 years. It didn't end until the end of last year in December. And what they're doing in areas like Beijing, where a lot of that video is coming from, where the hospitals are so full, is they've opened up what they call these fever clinics. So people who are sick are urged not to go to the hospital. Instead, they are sent to these fever clinics. Elizabeth?
Thanks so much for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.